McConnell-Smith here. Just checking in with y'all. I hope you've had a good weekend. Last time we were talking about my early marriage and my firstborn child. I realized that being married was well, with my first husband, was not a totally good fit. I mean, you know, he said he loved me. I really didn't love him the way you should love somebody when you want to get married. I realized that before we got married, but our communication just was not there. I would try to talk to him. He would just pretty much ignore what I had to say, do what he wanted, when he wanted. I do have to say that he did help with our firstborn. He was a very attentive father. As our second and third child came along, he got less and less as far as caregiving. I don't think that would be totally normal for somebody to be like that, but I didn't work, so I carried the majority of the load of the child rearing, you know, housework, food on the table type situation. And again, it was very hard, and I was not fully prepared for married life for myself. I was very strong-headed but I took a back seat to in that respect, and you know, my husband was head of the household, so I, you know, went along with whatever he wanted to do per se. And I mean, our marriage, it wasn't a totally bad one, but it wasn't a totally good one. If I had advice for somebody that was in a young marriage, you're young in age, you're young in years being married, I would say that y'all need to sit down and have like little heart-to-hearts. Not every day, but I would say at least a couple of times a week. Talk about your fears, your wants, your needs. Just overall communicating what you want out of the relationship, which we really didn't do. And of course, when the children start coming, those times tend to be less and less, because it is a lot of work to have a baby, and especially multiple children. It's totally a lot of work. And I wouldn't wish that on, you know, my worst enemy. You know, I tell people all the time, I would have a dozen kids if I could have a nanny or a couple of nannies. You know, look at Kim Kardashian. She's got 4 kids, and, you know, they're always with 2 or 3 nannies, and, you know, they're still able to go on vacation and, you know, do whatever they want. And, you know, regular folk just don't have that privilege, you know. So you know, I think that it made me a stronger person. My first husband was in the service when we were married, and we had our daughter, and we were very happy. We both were so much in love with our baby daughter, And, you know, 2 years, she was about a little younger than 2 years. And, you know, we started talking about, well, let's have another baby. I know my grandmother on my maternal side, she was an only child, and not that I didn't love my grandmother, I just thought she was a little odd. So I was like, I don't want my child to turn out odd. Not that she was odd in a bad way, but I mean, she was just sort of odd to me. So I was like, you know, every kid needs a companion, or, you know, somebody to tell secrets to in the middle of the night, or, you know, whatever. So we decided to have another baby. So I got pregnant with my oldest son. Totally different pregnancy. I gained maybe 30, 35 pounds at the most. And it was a good pregnancy. I mean, I had a little bit of morning sickness till I was like 2 or 3, oh no, I was probably about 3 or 4 months pregnant. Then it sort of weaned off and I didn't have too much. Versus my daughter, I had up to like 8.5 months worth of morning sickness. And I say morning sickness, it was really 24-hour sickness. I was sick in the morning, sick in the afternoon, sick in the evening, you name it, I would throw up. And, you know, that was miserable, and I had gained 100 pounds. So, but anyway, my second pregnancy was much better. So my husband got the opportunity to go to a tech school, and if he went by a certain date, I think if I remember correctly, if he went by the end of the year, finished the school by the end of the year, he got a $3,000 bonus. So our baby was due in October. And so we were like, well, does he go off to this 12-week course, or does he stay here and, you know, he has, you know, helps me with the birth of the baby and all of that. And we decided having the $3,000 was better than him staying home, because I thought, oh, I've already been through it, I can get it done, you know, not a worry. So he went off to tech school somewhere in Colorado, I don't remember. And at this time we were in San Antonio, Texas, at Lackland Air Force Base. By this time he had taken a job as a drill instructor for basic training. So he was the basic training, one of the sergeants for basic training at Lackland Air Force Base. So he went off to go to this tech school in Colorado, and I stayed home. And it was, you know, it was okay. I went into labor. My dad had sent his girlfriend at the time down, and I didn't know this, but she had a drinking problem, and she had brought several gallons of alcohol with her, and she was down here a couple of days, and I was just like, I called my dad and I was like, Dad, she's got to go home. You know, I can't deal with somebody that drinks all night and sleeps all day while I'm about to give birth. You know, I just couldn't handle that. So she went home. I called my mother-in-law, and she came down, and she stayed with me. And of course I had a very good friend of mine that her and her husband were also stationed with us at Tinker Air Force Base, where our daughter was born. And they had also, her husband also was a basic training instructor. So, so we became really, really good friends. We were really, really good friends up in Oklahoma City at Tinker Air Force Base, but we even became better friends down here in San Antonio. So we, so she was there with me as well, and so I went into labor, and I went to the hospital. My mother's sister at the time had come over. She was living in Houston, and she had come over and was, you know, there. And I was in the room. The doctor said, you know, I was about at that time that now the Air Force gave epidurals. You know, back when I had my daughter, they didn't give epidurals. Now they were giving epidurals. So the doctor came in, the anesthesiologist. Hey, I'm going to give you your epidural. And at that moment, I started having a contraction. He said, I'll be back in a few minutes. I'm going to go talk to the lady across the hall. And when I come back, I'll talk to you about the epidural, and we'll do it, and we'll get you going. So I was like, okay. So he left. By the time he came back, I had already gone past the point of having an epidural. So I could no longer have an epidural. And I was miserable. I was getting miserable. I was horrible. All they were giving me were shots of Demerol. I don't know, however often, I don't know, a couple of shots here and there of Demerol, which weren't, they were probably taking the edge, off of the epidural, but they were not taking the pain away. And that was really important to me. But anyway, what could I do about it? I just bend and grin and go through it. So I did. But my labor ended up being 27 hours. He was sort of like stuck in the birth canal. I'm not sure. They put like this, they put this thing on his head in the birth canal. It was like a plunger. They stuck it on his head and they tried to pull him out. He wasn't coming. Eventually, they used forceps, and they did a fourth degree episiotomy, which, you know, I didn't feel it because they'd given me pain shots while they cut it, but you know, I didn't realize, you know, what they were doing. But it took forceps, and 27 hours later, I got a little cone head shaped baby, my firstborn son. Sweet baby. He weighed 8 pounds 4 ounces. Now you have to remember, I'm 5'2". At the time that I got pregnant with my daughter, I was about 120 pounds. I had probably gained another 10 or 15 on top of that 120 after giving birth to my daughter. So I was probably about 130, maybe 135 pounds when I got pregnant with my son. So my doctor said I was very small down there, and that was the largest baby I could have. They were really, if my labor had gone on any further, they were going to do a C-section. Which at the time I was just like, I don't care, get this baby out. I was yelling at the doctor, you know. He was this He was a very tall, like, I don't know, 6'4", 6'5", blonde hair, blue-eyed German, a big, manly kind of man, and he had these huge, fat fingers. And he would say, "Now I'm going to check you," you know, and I would say, "Get your bear claws out of me." I was just, you know, I was horrible during my labor. But anyway, I got through it. I could not, I had to be on 48 hours worth of bed rest. I could not be on bed rest. I could not get up out of bed for 48 hours. I had to, if I had to use, they had put a catheter in me to use the restroom to urinate. And if I don't believe, I don't remember, but I don't believe that I had to defecate. But if I did, I had to use a bedpan because I could not move from the bed for 48 hours. And then I was finally able to take a shower, and I had to stay in the hospital for 7 days just to get rest and recover from my labor. And in the meanwhile, my son was in the NICU because he had swallowed Nerconum, which is, he had already had a bowel movement while he was in, before he was born. So he had had a bowel movement, so all of that was in his sac. So they cleaned it out the best that they could, but they just wanted to keep him 7 days in the NICU to make sure that he did not get pneumonia. Now, he did have some breathing type problems throughout his whole life. They never came out and said he had asthma or anything like that, but virtually every year, or at least every couple of years, he would get bronchitis. He would get a terrible bad case of bronchitis, and he always had to have an atomizer just in case when he was breathing, you know, he couldn't catch his breath. So he always had to have an atomizer, and he was always, you know, like I said, he was always sick. And just normal breathing, sometimes he would be wheezing, and it was, you know, that was just par for the course. I mean, that was my son. That's what happened. And so it was, you know, it was a little disheartening that that, you know, happened. But I mean, that is life, you know. Like I said, every pregnancy is totally different. What you think happened with your first pregnancy, you think, oh, well, that's going to happen again. And then maybe it will, maybe it won't. You never know. It's like playing the lottery. You never know, you know. Playing the slot machines. You never ever know what you're going to land on or what's going to happen, you know. So, like I said, it's just... I think, to me, he was the best baby. He didn't really cry a lot. He really didn't fuss a lot. He never really had any, you know, issues with, he always slept, you know, he always went to bed, always slept late. Oh, you know, he never was fussy. I mean, he was an all-around good baby. And when it came to potty training, easy peasy, nice and easy. You know, hey, here's the toilet. This is what you do in the toilet. You did it, and it was great. It was great. I really have to say, my daughter was a little harder at potty training, but I think I might have started off with her a little too soon. I started with her when she was 18 months. I think I should have waited maybe till like 20 minutes. But anyway, that was really, really, but my son, he was just like, I was like, here's the toilet, this is what you do. Boom, boom, bing, he got it. You know, and like I said, he was an excellent baby. No, a lot of crying, no, not a lot of fussing. You know, he was just an all-around good, happy baby. Well, if you have anything that you would like to discuss, please leave a message. If you have any questions, please leave them. And if you haven't subscribed, please subscribe. And like I said, I'm going to try. I've just been super busy lately. I'm going to try in the next couple of weeks to get together and come up with some different things to do, different subjects to talk about, to see if y'all enjoy that more. But please, please, please subscribe and tell all your friends. Thank you and have a good day.